highlight on these roles and responsibilities. So who's the medication safety officer? Medication safety officer is the clinical practitioner designated by the organization to serve as the authoritative expert in safe medication use. So what's his scope of practice? What is his expectations for the medication safety officer work? The medication safety officer mission is to prevent harm and to avoid, prevent, and ameliorate adverse outcomes for injuries such as patient harm stemming from the medication use process. So the medication use process includes the medication procurement, storage, prescribing, transcribing, preparing, dispensing, administration, and documentation and monitoring. So the medication safety officer most commonly reports to one of four areas: the pharmacy, patient safety or risk management, quality improvement, or senior administrator like the vice president or chief medical officer. Reporting process depends a great deal on the organization's culture, structure, and hierarchy. That's why availability of the medication safety officer reflect the organization, culture, and understanding of the value of medication safety in the organization. So benefits of reporting within the pharmacy department include elevated attention to medication safety through the medication safety officer involvement in department leadership, operations, and clinical services. Enhance understanding of pharmacy operations and ability to design safety systems and resolve identified risk. Close working relationships with pharmacy staff and increase access by pharmacy department to the medication safety officer expertise. Authority of medication safety officer should be the primary authority on incident involving medication. Also, the medication safety officer must have the support of the organization's administration to conduct investigations, interview staff, and coordinate process improvement activities. Responsibilities is shared by leadership, medication safety expertise, influencing practice change, and research and education. For leadership, they need to establish the vision for a safe medication use system, develop the medication safety plan, lead activities to achieve the vision and the plan, support and enhance the culture of safety. Medication safety expertise responsibility to serve as expert for medication safety, recommend safety system design, including technology and practice changes, facilitate management of medication-related risks and adverse events, lead medication safety committee. To influence practice change, collaborate with departments and groups to apply risk reduction strategies, and to align and integrate medication safety into the organization's strategic plan, employ also quality improvement methodologies to improve processes. For research and education, the responsibility is to participate in external event reporting program, integrate medication safety into orientation and training for all providers, educate colleagues, residents, and other healthcare professionals. So what are the attributes for success? The medication safety officer knowledge, skills, and abilities. So knowledge of the medication safety officer about all aspects of the medication use system. Healthcare technologies used in the medication use process and pharmaceutical care, clinical expertise, culture of safety concept, standards of practice related to medication use, and PI methodologies and tools. Skills. He needs to have leadership skills, communication skills, either verbal and written, time management, active listening, analytical, safe system process design, and project management. Then he has abilities to facilitate practice change, collaborate with staff at all levels, and effectively provide education and continuous education, apply defined strategies and protocols, function proactively versus reactively, write clear and concise policy and procedures. So the accountability and medication safety. What we know is that everyone has a role to play in medication safety. So what do we mean by accountability? It is about individuals who are responsible for a set of activities and for explaining or answering for their actions. This is the definition by Emmanuel and Emmanuel 1996. So the IOM recent report, the Institute of Medicine recent report, Preventing Medication Errors, outlines the actions that stakeholders should take, including a comprehensive examination of problems within the system and important safety strategies and policies needed for prevention. Practitioners, they are individuals, must speak out about patient safety issues, voluntarily report errors, near misses, and hazardous situations to internal and external programs, and share personal knowledge of what went wrong when an error occurs, and maintain competencies, stay abreast of current medication safety literature, and make the necessary changes in practice when safety recommendations are offered. The nurses, as a registered nurse or midwife, they are accountable for their actions and omissions. In administering medication, they should think through issues and apply their professional expertise and judgment in the best interest of patients. They must be aware of their interrelationship with the multidisciplinary team in the administration of medicine, for example, like theaters. Even when there is joint involvement, they need to remain accountable for their actions and omissions. Also, nurses must be aware of the patient's plan of care. They must know the therapeutic use of the medicine to be administered, including normal dosage, side effects, precautions, and contraindications. They must follow clear procedures to ensure the right patient receives the right drug in the right dose, by the right route, and the right time. They must check that prescription or the label on medicine dispense is clearly written and unambiguous. The nurses have if they have any uncertainties about the prescription, they must check with the prescriber or another authorized prescriber and clarify the prescription before administering the medication. They must be certain of the identity of the patient to whom the medicine is to be administered. Nurses must check the expiry date where it exists of the medicine to be administered. They must check the patient is not allergic to the medicine before administering it, especially for IV medication. Where complex calculations are required to ensure the correct volume or quantity of medication is administered, they are strongly advised to have a second practitioner to check the calculation independently. This will help to minimize the risk of error. So nurses must make a clear, accurate, and immediate record of the medicine administered, intentionally withheld or refused by the patient, ensuring the signature is clear and legible. It is also their responsibility to ensure that a record is made when delegating the task of administering medicine. The keys of the medicine cupboards, like in medication rooms or narcotic rooms, the drug refrigerators, and the medicine trolley must be kept by the nurse in charge of the clinical area in line with local trust policy. Nurses must ensure that they have returned the drug keys to the nurse in charge at the end of their shift. Nurses also must not administer intravenous or epidural medication unless they have received additional training and have a documented competency assessment in accordance with local trust policies. What is the responsibility for healthcare organizations? Organizations need to incorporate patient safety into their mission statement and uphold practice issues. The affirmation that patient safety is job number one must be accompanied by genuine action and financial commitment to a safe medication use system. The healthcare leaders also must use clear communication techniques that allow discussions to flow freely at all levels of the organization. Frontline practitioners must be included in all discussions on strategies designed to improve safety. And last are the external healthcare stakeholders. So regulatory regulatory, accrediting, and licensing bodies need to adopt safety standards as identified by scientific research and expert committees, and provide oversight to healthcare organizations to ensure that they are fully implementing those safety standards. The pharmaceutical industry should be held accountable for conducting pre-market testing using proactive risk management strategies such as failure mode and effect analysis, which is FEMIA, to detect potential labeling, packaging, or nomenclature problems. Post-marketing surveillance is also needed to detect adverse drug reactions and medication error-related product problems. When errors are reported to the manufacturer, problems should be fully disclosed to practitioners and changes should voluntarily be made to ensure safety. The manufacturer of medical devices and software should also be held accountable for performing safety evaluations and for seeking expert advice about new products. They must freely disseminate information to healthcare providers and consumers when appropriate, when design flows in previously launched products are newly discovered. So what is patients' responsibility here? That patients can no longer be passive about their healthcare. They must see themselves as active partners and not be intimidated by their practitioners' disposition to ask questions about their drug therapy. Patients should be informed that they are the last line of defense from harm and must be proactive by providing an accurate list of their medical history, allergies, chronic conditions, medications, and other important medical information to their healthcare providers. So the conclusion, since no single stakeholder can sufficiently change a system, all healthcare stakeholders must unite to prevent patient harm by sharing accountability for providing a safe medication use system. Significant improvement in medication safety will not be made unless we change the way accountability is viewed and begin to work together to finally design a medication use system that is truly safe. So as we know that all hospitals are preparing for accreditation. So what is the accreditation impact on medication safety? Accreditation is the self-assessment and external peer assessment process used by healthcare organizations to accurately assess their level of performance in relation to established standards and to implement ways to continuously improve the healthcare system. Standards, intents, and measurable elements. The medication management is a multidisciplinary team-based process that includes physicians, pharmacists, nurses, and other healthcare professionals, as well as patients working to achieve optimum safe use of medication. Medication management plays an essential role in protecting patients from harm, overuse, underuse, and misuse of medications are all important healthcare concerns. So benefits of accreditation. Why all hospitals should be accredited? And now, as you know, like CPPS, it's mandatory by MOH, by insurance companies, and that's why all hospitals should be accredited. So what is the benefit of accreditation to all organizations? It helps organize and strengthen patient safety efforts. Like patient safety and quality of care issues are at the forefront of JCI and CPPS initiatives and standards. It strengthens community confidence in the quality and safety of care, treatment, and services. Achieving accreditation makes a strong statement to the community about an organization's effort to provide the highest quality services. Also, it provides a competitive edge in the marketplace. Accreditation may provide a marketing advantage in a competitive healthcare environment and improve the ability to secure new business. It improves risk management and risk reduction. Like JCI standards and CPPS standards focus on state-of-the-art performance improvement strategies that help healthcare organizations continuously to improve the safety and quality of care, which can reduce the risk of error or low quality care. It may reduce also liability insurance costs. By enhancing risk management efforts, accreditation may improve access to and reduce the cost of liability insurance coverage. It provides education to improve business operations, JCI resources, and JCI commissions and CPPS resources, not for profit affiliate. They are non-profit organizations. They provide continuing support and education services to accredited organizations in a variety of settings. It provides also professional advice and counsel, enhancing staff education. The JCI surveyors are experienced healthcare professionals trained to provide expert advice and education services during the on-site survey, as well from CPPS during the round and the staff interview. They will give the education and consultation. It provides a customized intensive review. The JCI surveyors, CPPS surveyors come from a variety of healthcare industries and are assigned to organizations that match their background. The standards also are specific to each accreditation program. So each survey is relevant to your industry. It enhances also staff recruitment and development. The JCI accreditation can attract qualified personnel as well for CPPS. If you have any CPPS accredited or experienced staff, this will attract and enhance staff recruitment who prefer to serve in an accredited organization. Accredited organizations also provide additional opportunities for staff to develop their skills and knowledge. To be recognized by insurers and other third parties. In some markets, accreditation is becoming a prerequisite to eligibility for insurance reimbursement and for participation in managed care plans or contract bidding. It provides a framework for organizational structure and management. Accreditation involves preparing for a survey and maintaining a high level of quality and compliance with the latest standards. JCI accreditation provide guidance to an organization quality improvement efforts. So at the end, I would like to say thank you for everyone who has the role to play in medication safety. Thank you, Dr. Abul Futuh. Thank you for all team members who are attending. And let's have a safe medication practice.
شكرا جزيلا دكتورة. Thanks for your effort on this day. And thanks for Dr. AMANI and Dr. Amal. Today, two session is light session regarding medication safety. I think the participant, because now today is a holiday in Saudi Arabia, regarding to the Saudi Arabia National Day. Happy National Day for all citizens in Saudi Arabia. We hope you enjoy today, and don't forget tomorrow is the last day in this event. We have two sessions. We'll start from 6:30 p.m. With Dr. Nasr Al-Husseini, inshallah. We hope to enjoy with us and see all in tomorrow, inshallah. Thanks for all. Any questions for Dr. AMANI before we finish this session?